Good morning, everyone. My name is Zoe Perelstein, and together with my colleague Valentina Stella, we are both fifth-year medical students at the Universidad Nacional del Litoral in Argentina. We are here today to share a proposal that we believe is both timely and essential, an initiative to promote a smoke-free culture within our university. Our goal is simple yet powerful: to protect our academic community and our environment from the consequences of smoking by creating a healthier and more supportive campus atmosphere. We believe in a university that reflects the values of medicine and public health. To turn this vision into reality, we have identified a set of essential resources. We will need educational materials such as brochures, posters, flyers, to promote not only smoking cessation, but also broader smoke-free culture. We'll install durable signage in high-traffic areas. To make our workshops engaging and effective, we need stationery and audiovisual tools, as well as materials for digital campaigns and social media. We are also preparing cessation support kits, which will include visual aids and guides for emotional support. And finally, we plan to install environmentally responsible ashtray disposal stations. Now, let's talk about the current situation. There have been efforts in the past. Since 2018, some signage was installed, and there were attempts at raising awareness, but these initiatives lacked continuity. Signage was often poorly located or not visually engaging. There is no interdisciplinary educational component, no structure for cessation, and no real connection between institutional policy and everyday community life. Most importantly, there is no data being collected. That's where our proposal comes in, to bridge these gaps with sustainable evidence-based actions. Our initiative takes an interdisciplinary approach, broadening the focus to include not only just health, but also the social, cultural, and environmental consequences of smoking. We will build a system for long-term sustainability and replicability. We will increase and improve smoke-free signage, promote workshops on smoking cessation and healthy lifestyles, and encourage community engagement.
So how are we going to implement the project? Our main focus will be on education. Carry out several actions such as visual reinforcement, highlighting why we aim for a smoke-free School of Medicine along with a virtual campaign, extracurricular workshops referring to tobacco health, mental and social issues led by expert professionals. The topics will include smoking cessation, the effects of personal and environmental pollution, and the promotion of healthy lifestyles. Also, we will empower curricular content related to smoking in 3rd and 5th year of medicine, and we will participate in the regional health meeting organized by the faculty. We plan to request $50 from the institutional budget. Additional funding will come from the Student Health and Wellness Program, and if more is needed, we will ask from external resources like local public health departments. From August to December 2026, our benchmarks include finalizing the project design, launching the project, installing signage and beginning the workshops and virtual campaigns, participating in the regional health meeting, and collecting data and presenting results of the project and propose its extension to other university departments. Our team includes myself and Zoe, who coordinates the project, faculty, professors, and authorities who provide academic and content support, expert workshops speaker, and peer volunteers who help ensure the project's continuity and promotion. We are glad to present this project as part of an ongoing SNO chapter. We believe in building a smoke-free campus in a context of a culture of health, one that promotes a cleaner, healthier, and more inclusive learning environment. So let's lead by example for ourselves, our peers, and our future patients. Thank you.
Thank you.
Greetings everyone. My name is Ritvik Rao and I am an intern at JNMC and KLE Hospital, Belgaum. My project, Clearwell, aims to leverage IoT to provide clean, drinkable water to the rural population of Belgaum, thereby increasing their standard of living and quality of life. We are currently at the idea development stage and we have attained informal backing from our university. We're seeking financial support to the tune of 35 to 45 lakh Indian rupees, which comes to around 40 to 50,000 US dollars. We need this to deploy 230 IoT based water quality monitoring systems in and around Belgaum in 23 villages. Our plans for the near future are to develop, test, and validate our prototype, as well as to apply for grants from research agencies such as BIRAC. The problem I'm trying to solve here is unsafe drinking water. As you know, in a country like India, which has limited infrastructure, especially when it comes to water quality monitoring, there can be a lot of contamination of drinking water, which will in turn lead to a lot of waterborne diseases like cholera and typhoid, gastroenteritis, and so on. These diseases can be easily avoided if there is a water quality monitoring check at the site. This is where my solution, Clearwell, comes in. We aim to have on site monitoring with portable sensors such as pH, turbidity, chlorophyll, temperature, etc., which will then transmit this data in real time and have instant alert systems for drop in water quality. We expect to provide cleaner drinking water for the rural population of Belgaum, which will lead to improved quality of life and decreased burden on the healthcare centers of Belgaum, such as my hospital, KLE. Our business model is a public-private partnership venture, which will require seed funding for the pilot program, as I've mentioned before. We also aim to form partnerships with the local municipality and NGOs. We aim to optimize costs by using open source hardware and training existing local personnel. Coming to the operational model, our hardware monitoring kit will cost around 13,500 up to 20,000 rupees. And our team has come up with a phased deployment plan, starting with a pilot program in 2 to 3 villages with an estimated final coverage of 23 villages in and around Belgaum. Our long term sustainability is to be attained by the PPP model and further expansion to other districts. Our targets are in the first 3 months, we want to establish the pilot program and validate our prototype. In the following 3 months, we want to expand and form partnerships with the municipalities and the local government. And by 9 months, we aim to complete the Belgavi deployment program. This is the team. I'm an MBBS intern at KLE Hospital, as I've said before. I'm the former joint secretary of KLE's Red Cross division, and I'm also a member of the District Red Cross of Belgaum. My mentor is Dr. Sulakshana Baliga. She's a professor of community medicine here in JNMC. She's also the co-convener of TUFH of South India, and she has experience in publication and patenting of prototypes, as well as an expertise in AI domain. Thank you.
Hi there, my name is Michaela Cuccimelio. I'm an incoming third-year medical student at the Northern Ontario School of Medicine in Thunder Bay, Ontario, Canada. And I'm here today to present our project for the student network organization called the Northern Equity Project, advocating for impactful change in Northern Ontario. Our pilot project is addressing pain management inequities in women's reproductive health. Why is this our first initiative? Women experience severe undertreated pain during IUD insertions because current pain management practices are inconsistent, outdated, and lack cultural safety. Inequities in pain care for Indigenous people are well documented and are perpetuated by systemic gaps, resulting in avoidable suffering and reinforcing mistrust in the healthcare system. Culturally safe, equitable pain care is overdue and non-negotiable. What do we need to get this project off the ground? Number one, we need funding. This funding will be used to deliver the first year of workshops, materials, and community engagement sessions. Additionally, we will seek out mentorship for provincial and national funding sources. Number two, partnership. We are hoping to form institutional partnerships with Nawsim University and Lakehead University to help integrate our education workshops into student curricula. Lastly, support. We need guidance from clinical experts in women's health and Indigenous health mentors to ensure culturally safe care. Now on to the gap analysis. We have identified a significant gap in advocacy and education around pain management during IUD procedures. Our approach to this issue will include education, policy, advocacy, and community collaboration, as well as workshops and seminars. There has been no previous work done to specifically address the intersection of pain management, gender equity, and cultural safety. This SNO group would foster a long-term platform for advocacy and interdisciplinary dialogue and amplify student leadership in Northern Ontario. Plainly, this is our proposed solution, a student-led interdisciplinary advocacy platform that provides workshops and raises awareness, partnership with Indigenous communities, and advocacy for implementing evidence-based, culturally safe pain protocols. An example of some of the work we hope to do would be an information session run by healthcare professionals discussing evidence-based, equitable pain protocols and feasibility of implementation. Regarding funding sources, we will be seeking out funding from internal grants, which would be interest groups funding from Nawsim University Student Council, Nawsim University Research Funds, and Lakehead University Club grants from the Student Union. External grants, which would include funding from the Canadian Federation of Medical Students and the Ontario Medical Students Association, as well as private funding, which would include private donations from local advocacy groups. The initial funding we need to get this project off the ground would be $200, which we will hope to seek from Nawsim University Interest Group Fund. So what are our milestones? From months 1 to 3, we hope to launch the project. So this will include establishing partnerships with Indigenous organizations, securing initial funding through internal grants, finalizing culturally safe workshop curriculum, and recruiting student volunteers and workshop facilitators. Months 4 to 6, this will be our pilot delivery. So we'll host our first pilot workshops at Nawsim University and Lakehead University, collect participant feedback on workshop quality and cultural safety, and begin developing advocacy materials, for example, policy briefs and toolkits. Months 7 to 9, this will be our expansion. Here we'll refine workshop materials based on feedback, expand workshops to additional Northern Ontario communities, and build connections with local health centers for wider delivery. During this time, we'll also apply for larger grants from the Canadian Federation of Medical Students and the Ontario Medical Students Association to sustain our scale up. Beyond the 9 months, this will be our sustain and scale period. We'll publish the workshop results and lessons learned, formalize a sustainable student-led advocacy chapter for ongoing leadership, advocate for adoption of culturally safe IUD pain protocols in Northern clinics, and share the model with other Canadian medical schools and Indigenous communities. Who is our team? As I mentioned, my name is Michaela Cochimilio. I'm an incoming third-year medical student at Nawsim University. I have a background in applied life sciences at Lakehead University, and my relevant experiences include quality improvement studies and qualitative analysis pertaining to obstetrical care in Northern Ontario. I also have leadership experience through holding leadership roles in interdisciplinary student-led organizations. My passions include women's health, health equity, healthcare provision in Northern Ontario. My counterpart, Jaden Smith, who couldn't be here today, is also an incoming third-year medical student at Nawsim University. She has a background of Algonquin mixed ancestry and a degree in biomedical sciences from the University of Guelph. Her relevant experiences include pharmacology research and community leadership through student organizations. Her passions include reproductive justice, equitable and culturally safe healthcare. Other Nawsim students and Lakehead University students will be encouraged to join and succeed us once we graduate with this SNO chapter. Thank you so much for listening to our pitch today, and we hope you enjoyed. Have a nice day.
Assalamu alaikum wa rahmatullah. We are Manasik Asil Ahmed, medical student at University of Jazeera. Today we are so excited to introduce our network and mission, which will be presented by me, Manasik. So our project title is Resilience Network, Health Access, Research Conference, and Mental Wellbeing. As we know, Sudan crisis has left students and communities without care, support, or system to build from. In response, the Resilience Network brings students together to lead in 3 distinct but complementary sub-projects, which are SHAN, Sudan Health Access Network, which will provide essential care access to communities in conflict zone through both conflict zone and affected area, through both virtual clinic and up-to-date interactive maps to locate health service. We also have a Jazeera Research Conference, which will build research capacity for more data to guide intervention. Moreover, we have virtual mental health program, which will offer mental health support for medical students. So we can consider SHAN as an intervention and mental health program as essential needs for who will guide the intervention, and the Research Conference as a guide of these interventions. I hope the logo and tagline is clear for you. To make this vision a reality, we seek support in several key areas: funding, mentorship, and partnership. Funding, we ask for $20,000 for telehealth technology from NGOs and $30,000 for conference needs supported by University of Jazeera Public Relations Office, and $8,000 for mental health platform subscription from a mental health organization. Mentorship, we ask for guidance from TUFH, an expert in public health, trauma-informed care, and research conference. Partnership, it will be with WHO, Sudanese Red Crescent, mental health organization, SABA, universities, media, sponsors. Now let us understand the problem more deeply. We catch three major gaps created by Sudan's war, which are first gap is access to health care is broken. As we know, clinics are damaged or unreachable. The second gap is mental health needs arising for students, especially stress, trauma, and rest issues. Third gap is student research. There is no structured way to turn students' ideas into action or evidence. The Resilience Network fills all three gaps. The Resilience Network uniquely addressed the crisis through three integrated programs: SHAN, improve health access via mobile clinics, virtual consultation, and health service map. The Jazeera Research Conference will empower students to generate actionable research based on real community needs and field data. Mental health program, deliver virtual mental health support to vulnerable population of students. Together, they create a closed loop of intervention, as you see on the figure on the slide. Financial model, we divided the required amount into three phases: before, during, and after the project. You can see detail with needs and amount on the slide. Regarding our business model, we can say that the Jazeera Research Conference will be the Kickstarter of the Resilience Network. And that is because we will schedule it with the University of Jazeera Golden Jewel in order to enhance promotion of the network. In short term, the Resilience Network will be managed by partnership between co-founders, SNO Jazeera and DEMSA. In the mid-term, it will be managed by co-founder and SNO Jazeera. And in the long term, it will be under the SNO Jazeera Annual Action Plan. When it comes to benchmark and milestones, we can say the first 3 months will be for promotion and preparation, and next 3 months will be for finalizing, and last 3 months will be for launching. You can find it more detailed on the slide. Beyond cycle is also figured on the slide. Team structure. We can say that the project supervisors will be co-founders, which are Ahmed, Asil, Manasik, and the project coordination will run through several coordinators. Project oversight and cross-program coordination will done by SNO Jazeera, and volunteer mobilization and logistics will done by JEMSA, Jazeera Medical Student Association. SHAN will be led by medical students and junior doctors in Jazeera University. Public health intern will assist in mapping and virtual care. Jazeera Research Symposium will be coordinated by scientific committee of students and faculty. Research advisors will be university staff and alumni researchers. Peer-reviewed abstract system will also be found to ensure academic quality. Mental health program will lead through trained student facilitators and the supervision of Sudanese mental health professionals. We also structure support teams for media, finance, outreach, logistic committees, and public relations. Thank you for your time.
Hi everyone, my name is Nweke Nwadi, SNO Nigerian President. I'm glad to bring this initiative to you, which is mental health, fighting addiction and depression in Nigeria. Why this matters? Nigeria is facing a silent crisis. Depression and addiction are rapidly increasing among youth, especially in universities. Yet, the mental health support system remains dangerously inadequate. This project aims to confront this crisis head-on by creating awareness, providing early intervention, and connecting young people to professional care and peer-led support. In 2024, I had a deeply personal experience that reshaped my passion for mental health advocacy. A friend of mine, once one of the brightest students in her class, began to struggle academically. Her performance declined rapidly, she lost interest in the things she once loved, and her once vibrant spirit grew dim and distant. I later discovered she had been silently battling inner struggles. Without proper support or guidance, she turned to harmful coping mechanisms. And this led me to start asking myself these questions. What if there had been access to professional care? What if a school had prioritized mental health awareness? What if someone had noticed early enough? These questions continued to echo in my heart. Her story first my commitment to creating a system where no young person suffers in silence. The growing challenge in Nigeria. Over 75% of people with mental health conditions in low-income countries like Nigeria receive no treatment at all, according to World Health Organization 2023. 20 to 30% of Nigerian youths are affected by mental health disorders. Depression and addictions are the leading cause of disability amongst adolescents. 1 in every 5 youths battles with a diagnosable mental health. Less than one psychiatrist per 500,000 people in many African communities, according to World Health Organization Mental Health Atlas 2020. Among all, stigma, cultural beliefs, trauma, and poor coping skill often leads youth to substance abuse and prevents early intervention. Our solution will be through awareness campaign, peer support network, anonymous helpline, and through referral system. Our initial asking for to kickstart this initiative is 1,000 USD, and we're going to have a strategic partnership with mental health institutions, media platform, and schools. How the allocation will be used. 25% of this allocation will be used on educational materials to design and print awareness materials. 25% will be used on ambassador training, and 20% will be used on helpline groups and other miscellaneous activities. 30% will be used to host 5 major university outreach events. The sustainability plan will be through voluntary driven, through grants, corporate social responsibility partnerships, and through premier mental health training programs. The key milestone here will be in the first 3 months, we're going to launch this initiative in 3 universities, train 30 ambassadors, and set up helplines. In the next 3 months, we are going to reach out to over 5,000 students and host 5 major university events and partner with at least 2 mental health clinics. In the next 3 months, we are going to expand to 5 more universities, publish Empower reports, and launch digital platforms. Beyond, we are going to host national summits, youth mental health, and subsequent SNO team leaders who will take over this project. Here are our dedicated team leaders, our core team driving these initiatives. And here also we have our partner, Nigerian Health Watch. They're known for public health advocacy and renowned for data-driven campaigns. They will be providing us with technical expertise, media visibility, and health system linkage. Thank you.
Hello everyone, I'm Rawan Saeed, a 4th-year medical student at University of Jazeera, Sudan, and Imru's regional representative for the 2025 term. My project is titled Interprofessional Education for the Nations. It's a multinational approach that aims to implement IPE into SNO local chapters at the regional level. The asks for this project have been divided into 3 categories, as you may see. I would like to start by discussing the documents and materials. For the documents and materials, we'll need access to a professional Zoom account as well as access to prepaid online research databases. Along with that, we'll also need access to university facilities for our bi-monthly meetings and tri-annual events. For the human resources, we ask for 2 or more faculty members from each health college for administrative and collaborative tasks. A minimum of 1 student from each health college is needed for creational and manual tasks. Along with that, 3 to 4 interprofessional education advocates are required to facilitate the programs. I ask for $1,500 in funding for each local chapter for a professional Zoom account subscription, fees and staffing, marketing and promotion, logistics and printing, and online access to resources. Now on to the gap analysis. The problem addressed by this approach is the poor communication between students of various health colleges. This prevents interprofessional exchange, which is needed for career development, as it is inevitable for these students to face, interact, and work with each other post-graduation. So why don't we cultivate them to start that pre-graduation? The problem is solved by involving local chapters in the IPE for the nation's program. Each local chapter would be provided with an IPE plan, which would later be customized to the local chapter's needs. Each plan includes IPE definition sessions, workshops encouraging IPE, and networking events to implement IPE into real life. National and regional collaborations will then fall into place. Our financial model includes faculty funding, attendance fees from the programs hosted, Macy's Foundation's National Center for IPE, and Interprofessional Global's ANIC. Our milestones have been divided into segments of 3 months each. First 3 months, signing local chapters and scouting for facilitators. Second 3 months, hosting IPE introductory sessions, beginning networking events, and working on resources. Third 3 months will include the IPE project planning at each local chapter. Fourth 3 months will be the tracking the success of the IPE approach and planning for the regional collaboration. The fifth 3 months and marking the beginning of the second year will be the execution of the regional collaboration, as well as promoting for new local chapters to join. Our team involves interprofessional education organizations, faculty members, members of student organizations, SNO IMRU, regional administration, as well as the national teams. This team will be led by the SNO IMRU regional representative, along with the support of the regional team if present. Activities, however, at the level of a local chapter will be administered by the local chapter itself, only surveyed by the regional management, but large-scale events, including collaborations, will be managed by the regional representative. This team allows large-scale, experienced, and thorough execution of the IPE for the nation's program by using multiple resources, knowledge levels, and collaborative efforts for the regional benefit. Our success scale includes enriched student circles, increased student participation, student subscription increases in the program, as well as hopefully implementation of the program in real life health sector post-graduation. Thank you for your time. I hope we can all benefit from this program and that we can actually execute it and see the fruit of it all. Thank you.
Bringing life to our healers, SNO chapter in Nashta, and I'm Alia Medhat, intern doctor at Swiss Canal University Hospital.
And I'm Yasmin Doma, an intern doctor at the same hospital. So pay attention, we are making better lives for our future healers.
Our ask is, we ask our faculty administration for the approval papers, collaboration with engineering faculty for making the software system, assigning us with psychiatrists, trainers, advisors, and making meeting spaces and supplies and logistics available.
We also ask the private sector for a fund to expand our work and hire new personnel, and we ask the universal health insurance for regular tests for the residents and the charity work for donations and grants. So the problem for our undergraduate students is that the current student engagement initiatives and activities has a gap between what actually students need and what they provide them. So we can solve that by a comprehensive student networking system.
Our problem for the postgraduate part, or especially for residents, is that residency is not an easy part. It is the first part or first step into the career. And residents are facing two things. First, load of work, especially if the infrastructure and logistics are not founded or not. The second thing is load of people interaction. They are the first line to encounter patients, relatives, referrals from other departments, and co-admissions would put them under pressure of interactions with different people with different personalities. All of this loads put them under psychological stress, which needs a network to relieve. And because we know that medical life is tough, we want the residents and the undergraduate to live every moment and enjoy it, not to postpone their lives.
So we are dealing with 2% of those who join university each year, representing the medical field. First phase for the medical students and the second for the other faculties. And we also dealing with the university students at the beginning of their life and the residents at the beginning of their career. So our aim for the undergraduate network is to provide the students with a peer support in addition to an academic one. Also to provide them with the mentorship opportunities in different fields, especially in the research, and to develop their soft skills like leadership skills, and provide them with a collaboration with other different hospitals and students activity, and provide them with a community engagement activity and improve their communication chain. This all will lead to an enhancement in the university image.
Our solution for residents is the following. We are going to relieve their psychological stress through software application. This application will include the following. We will have mental health coach to track their psychological health, and this will be followed up by psychiatrists. We will also track their physical health through checkup for their daily vitals and making regular lab checkups every 3 to 6 months. We will announce short seminars or webinars through our application to give them tips and tricks about management and how to relieve the stress. We will make offers and deals with the small startups to give them or provide them with daily services like laundry and healthy food. And finally, we will make subgroups in the application to allow easy communication between residents, whether paging on-call residents or to deal with different things in life.
So our expenses will be spent on the personal hire, software preparation and spaces, promotion material, events and logistic training. And our revenue streams at the first phase will depend on the faculty budget, private sectors, grants and donation. And in addition to in the second phase, we will expand it to a participation fees, workshop events, merchandise sales.
For our milestones in first 3 months, we will finalize our financial plan, complete our team and the pilot study. In next 3 months, we will complete our software and finalize the deal with the investors and sponsors. And in the last 3 months, we will start our execution.
And finally, thank you.
Assalamu alaikum. Hello everyone. My name is Sayeda Khatib, first year medical student from Mahfad University, presenting to you today my project Collaborative Care Network towards enhancing medical knowledge and services in Sudan. I am from Sudan, a Northeast African country that enjoys one of the most established medical education systems, producing skilled health professionals who serve both locally and globally. With these enthusiastic health professionals and strong academic legacy, Sudan can be actually positioned to be a regional leader in innovation, technology-driven healthcare education. However, with the events of the past 3 years of conflict, preceded by the COVID-19 and the country economic and infrastructure, we're still facing some challenges like most African countries, with the insufficient clinical exposure and the health inequalities in itself, specifically in rural areas, involving students in accreditation efforts, integrating technology and research capacity across medical universities, considering the very fragile infrastructure of technology in Sudan, and also clinical training, considering the current conflict events that disrupted the health system in itself. So why now? Sudan needs us now. Sudan is going through a recovering period that needs its youth and health professionals to actually contribute to the development of the health system and reestablishment of this disrupted system. Through this program, I aim to reduce health inequalities, increase graduate competence through their clinical experiences and medical education. Considering the right platform and partners, bringing them together, we can transform these current challenges into a resilient, connecting medical education model for Sudan's future doctors. So, how? Through the Collaborative Care Network, a mentorship-based digitally supported platform connecting universities, hospitals, and students to advance their quality education, adopting the ECHO model, a global ECHO model that has been tested throughout the globe. It stands for Extension for Community Healthcare Outcomes, that believes in transferring knowledge, not people. Using technology to leverage scarce resources, share best practices through case-based learning to master complexities, and utilizing a web database that preserves materials and keep it for future share. So the project scope will be mainly around mentorship and experience sharing, connecting the three entities: universities, hospitals, and medical students and staff. So my plan for the first year will be to bring in essential partners who already adopting ECHO model in Sudan, like the Dongola University and Jazeera University, and also establish knowledge hubs in SNO chapters in different universities, starting from Ahfad University, of course, and connect these hubs together to initiate the learning processes. The expected outcomes will be around that students will graduate more competent and confident regarding their knowledge. Faculty mentorship and knowledge sharing will expand regionally as I aim to include SNO chapters from other countries. Hospitals and universities who are experienced will be serving as an excellence center to share their competencies and experiences with less experienced entities. And definitely this model, we would like it to be sustainable, and we will work hard to make it sustainable digital infrastructure for medical education in Sudan. So project team will be me, Said Al-Khatib, leading this project. And through the past period and initiation of conversation with implementing partners, SNO chapters in Jazeera and other universities, definitely receiving support from as mentorship and technical support from SIDRO, a national organization that adopted this model for the first time in Sudan, and ECHO Institute, who also provides rigorous local support for those who wants to adopt such a hub. And definitely partner institutes, university, medical faculties, and teaching hospitals. So I would like to invite you to join me in advancing medical education and services in Sudan. For my faculty, I would like to ask for this project endorsement to be a scalable innovation in Sudanese medical education, help in assigning faculties to join as subject matter experts and mentors, support technical setup of these hubs through providing lecture halls and digital infrastructure in university, and integrate this program to be part of the educational improvement. Definitely, this program will need a financial support. So for the first year, I aim to just utilize the existing infrastructure and utilize the partner support, existing partner support that provided, and fundraising efforts if needed. Thank you for your attention. Any question, I'll be present in this presentation.
If you wish you had started your research journey earlier, join me as we make that possible for others. I'm Frank Kayemba, a medical student at Bositema University in Uganda. We are launching our SNO chapter with a project that we've called the Student Research Lab. This project is aimed at equipping undergraduate medical students with research skills in a sustainable way, because institutions are more of a pipeline. Students are coming in as others are graduating. So without a structured program, we always get a deficit whereby students have to start from scratch because the others who had the skills have graduated. My ask is $350 annual funding, $2,000 annual grant allocation, and 12 skilled researchers to offer training. So far, we have the 10 researchers, and we are seeking for more 2. Undergraduate research has been started. It's a lot of advantages to it. It increases critical thinking, innovativeness, it increases social accountability, and even shapes career choices. Students are very eager to learn. I've been getting at least a dozen of students every semester approach me to be mentored in research, but neither do I have the time nor the resources to do that on my own, and that birthed this project. So we are going to be doing a structured training that happens twice a year. It takes about 3 months, and it is done on the weekend as online sessions, which shall be taking 2 hours, and actually it will be every other weekend on a Saturday. So that accounts to 6 weekends in the 3 months, and we shall recruit 50 students with a target of 50% completion. The sessions shall be delivered by researchers, and the program shall end in an essay writing competition. We hope to get some grants to fund a few projects that would come from this training. And it will be sustainable in that we have funding from the faculty to enable the administration of the project, and students from previous cohorts shall be able to lead the training of the following cohorts. This is the financial model. Every student who wishes to join SNO shall have to pay their own subscription, which is about $5 in 3 years, very affordable. We are seeking $350 from the institution, and that will cater for graphics and branding, administration support, and the student essay writing competition. We seek $2,000 from the faculty as a grant allocation for undergraduate research, because usually they allocate grants, but they put so much money on them, like 10,000 US dollars. And rarely do students have projects that consume that much money, nor do they have the reputation to get it, even when they have the projects. So, so far we have started the planning for the cohort of this year, which shall be 1 cohort, because we're already in the 2nd quarter of the year. We shall be onboarding students this month, and the training shall start September to November. By December, we shall be evaluating our performance in the first cohort and planning for the future cohorts. 2026, we shall have the first cohort running from January to April, and the second cohort from August to November. This is the team. I, Joshua, and Jonathan, 5th year medical students. We are finalists, and we've been involved in research for the past couple of years with a few publications and skills from data analysis to doing systematic reviews. And the other colleagues are representing the other programs that we have in the university. Michael is representing the medical students, Martha, pharmacy students, Stephen, nursing students, and Jemba is representing the anesthesia students. So together, this is our team, and we hope that we shall make this possible.
Hi everyone, my name is Laviani. I am a nurse and I am a Master of Science student in nursing. I'm here to present the project Mental Health Education for Inclusion and Prevention. This is a university extension project that trains students to promote inclusive and preventive mental health care, especially in vulnerable communities. I believe deeply in the power of knowledge created between the university and the communities, and the prevention as a raw strategy for improving health. Today, we're asking for support to help formalize the project inside the university and access basic resources, like a space for meetings and educational materials. We are also looking for future collaboration to provide students scholarship through university programs or external funding.
Hello everyone, my name is Mirella. I am a psychology student and I will be continuing the presentation. What we have now in Brazil is that not everyone has access to quality mental health care, especially people from marginalized communities. Even though our health system is built to include preventive actions in threats, the prevention often doesn't happen as it should. Besides that, what it has that every day many students in health courses also graduate without real experience working with vulnerable people. Our project responds to this gap by training psychology, nurse, and medicine for beginning students to act in the community with a focus on cultural sensitivity and social justice. They will learn directly with professionals and teachers and then act in the community with guidance and supervision. These prepare future health workers who are ready to listen, care, and act preventively. This is a public university extension project focused on mutual learning and social impact. It doesn't aim to generate profit, but it supports educational and health equity. What I have for plan is that we will start with a selection process to invite students to enter the project. After that, they will pass 3 months working and learning about interdisciplinary training based on 3 models with professors and professionals. For the next 3 months, they will act in the community in partnership with local health service. After that, experienced students will lead new groups. So this way, the project still grows while staying connected with the real needs. If we succeed, the impact will be real. Students will become more prepared and socially responsible professionals. Communities will receive more attention, care, and preventive support. And after that, the university will play a strong role in solving real problems connected with the reality. We finally want to build a bridge between knowledge and care with inclusion as its center. Finally, this is our team. And together, we bring academic knowledge and practical experience to build a strong interdisciplinary team. Our shared goal is to prepare students to act with cultural competence and to promote mental health care in the real world. Thank you for listening.
Hello everyone, thank you so much for having me. I am Proga Paramita Roy. Currently, I'm a 5th year medical student from Dhaka Medical College in Bangladesh. Today, I'll be presenting my project titled Connecting Student Voices Across the Globe, Establishing a New SNO chapter in Bangladesh. So over the next 5 minutes, we'll be going over these topics and project objectives. So the first, although in Bangladesh there are institutions and organizations that are for the medical students and for nursing students individually, there is no such organizations that can connect all these life science and healthcare students together. So to establish a network of dedicated youth, a young group from health and health sciences, we will be establishing this project. So after achieving the mission, what we want to achieve is develop leadership among undergraduate health care and life science students with a view of achieving health equity with a collaborative and research driven. For the benefits, we have subdivided them into for the students and for the institutions. So a young student can get a common platform where they can get their ideas shared, interdisciplinary approach from their undergraduate education level, and exchange of international resources to other SNO chapters. for institutions and their benefits, introduction and exchange of international endeavors at their own campus, representation of these implementations at annual conferences, international conferences, multidisciplinary action towards achieving health equity and health for all holistic, evidence-based policy, which can ultimately go into decision making. So, what are we asking from the TUFH? As it's a very new initiative, we'll be needing official proof from the TUFH and of course from the SNO for procedural assistance for getting endorsements from the individual universities. Supervised training all throughout this project until formation of the new SNO chapter, and ultimately guidance until it's published in the TUFH journal. So this is the operation model. It will be run under the name Connecting Student Voices Across the Globe with the aim of establishing a new SNO chapter. This will be a supervised research training comprised of undergrad science students with representations from the following, like medicine, dental, nursing, pharmacy, and other healthcare institutions. For communication with individuals and international facilitators, we'll be using social media, and for intercommunication, we'll be also using WhatsApp. So the project will be run for 9 months. For the division of perfectly achieving our final goal, we have divided this project into 3 trimesters. For the first trimester, we'll be using the team formation, and what we'll be doing is finalizing the whole team and having proper representations from perfect institutions. For the second trimester, we'll be focusing on gap analysis and ultimately going to a research protocol. And after that, network and outreach. So we have proper representations, a minimum of 20 institutions under the United Grant Commission, which gives basically endorsements to different universities in Bangladesh. For the third trimester, we'll be drafting the final manuscript, which will be ultimately going into the TUFH journal. As it's a very new initiative and no other things have been introduced yet and not many people know about it, we will be using the free resources like the Google Workspace and Microsoft Sheets and Documents, and for work progress we will be using the Notion. So this is the team, the very initial team. I myself will be leading this team as a project lead, and we have selected 3 project coordinators. First of all is Aisha Siddiqa Isha. She's a 5th year medical student based in Dhaka. What she brings to the team is her interpersonal skills with communications and public relations skills at her for this project that is very necessary to communicate and establish those connections and maintain those connections. Next up is Famila Jan Anika. She's also a medical student based in Dhaka. What she brings to the team is the external affairs ability she has shown in many national and international conferences all over the world and in the country. Last but not the least is KG Shubono Bithi. She is the engineering student from the Bangladesh University of Engineering and Technology, and what she brings to the team is her analytical mind. Through that, we want to achieve the evidence-based policy that we're actually aiming for after finishing up this project. So this is all. Thank you so much for listening to me for the past 5 minutes. It has been an amazing journey talking with you, working with you, and under your guidance, and hopefully we can continue this collaborative relationship for the rest of our lives. Thank you so much.
Hello everyone, today myself Sheikha, Hind and Salim are going to be explaining about the initiative of SNO Sharjah, Medibox, Your Health Within Our Reach. By integrating the students' perspectives, this initiative ensures the real needs are actually met, creating a healthier, more inclusive environment at the University of Sharjah. Because students often lack easy access to over-the-counter medications and essential health supplies, especially during late hours, this leads to untreated symptoms, reduced well-being, as well as missed classes. We are seeking 150,000 dirhams funding for pilot launch partnerships with pharmacies and tech providers. This is supporting phase 1, including 3 machines, a prototype, and 6-month trial at one campus, as well as technical and regulatory mentorship. Our gap analysis is the lack of students' easy access to over-the-counter medications, especially during emergencies, reducing their overall well-being. Existing campus clinics have long waiting times and limited hours. Off-campus pharmacies are inaccessible during late hours for dorm students. Students need privacy and convenience when accessing their health products, and no current system integrates the smart technology and healthcare access directly in dorms. We're going to solve this problem by providing 24/7 access over-the-counter medications. Due to that, it's actually avoiding the overprescription risk, AI recommendations for products based on their symptoms, supporting multilingual interface, placed in multiple regions in the dorms and on campus, environmentally friendly by having a recycling bin for any expired medications.
To launch Medibook successfully, we need two things: money and resources. Financial support has to secure smart vending machines, stock them with essentials like over-the-counter medication and menstrual kits, and hire high-tech experts to build an AI-powered app that connects to those machines. Our business model focuses on efficiency, reducing hospital visits for minor issues by making health supplies accessible anytime, especially in student dorms. For Redaview, we're looking at potential partnerships, maybe with insurance providers or camper vendors. Funding can come from the university grants, health organizations, or even tech sponsors. We'll track progress with clear benchmarks, starting from the prototype testing to full campus rollout. Our team is made up of passionate students from the SNO Sharjah, each bringing different strengths. Most importantly, Medibox isn't just about health, it's about supporting students' academic focus by ensuring their basic medical needs are within reach. To keep this going, we plan to collect feedback through surveys and QR codes near Medibox. Plus, a student health ambassador will lead a mini campaigns and help younger students continue the project even after we graduate. This isn't just a one-time solution, it's a student-led platform that grows within tomorrow's needs.
We've outlined a phased plan starting with design and pilot testing in July to September 2025, and by early 2026 we'll scale to more campuses and introduce wellness subscriptions. By mid-2026 we'll be focusing on performance monitoring and preparing for a large rollout. And then beyond April 2026 we plan to expand across the UAE, add telemedicine and build strategic partnerships. This slide shows our core belief that students can't focus academically if their health needs aren't met. Medibox ensures access to essentials like painkillers and first aid, helping students stay in class and perform their best. Our team is cross-functional. I bring medical and leadership experience. Hind leads tech and operations, and Sheikha handles user engagement and marketing. Together we cover all aspects from design to implementation. This slide shows our core belief that students can't focus academically if their health needs aren't met. Medibox ensures access to essentials like painkillers and first aid, helping students stay in class and perform their best. Over 2,000 dorm students face health issues like asthma or menstrual pain, but clinics aren't always open. Medibox ensures fast access to basic health supplies when it's needed most.
And of course, to ensure the continuity of the SNO chapter, we will provide surveys and QR codes next to Medibox to involve the student's voice, establishing the student health ambassador and communication between different tiers, as this isn't only about solving a problem we have today. With the launch of SNO Sharjah, we're building a platform for student-led health solutions to continue to evolve with the needs of tomorrow. Thank you.
Good morning, good afternoon, or good evening to you all, depending on where you're joining from. We are Alexa Ineviona and Lozine Shabi Kuzwe, senior medical students from the University of Global Health Equity, UGHE, in Rwanda. And today we are excited to share with you our initiative developed through the Network Towards Unity for Health, the OSCE Ready Sprint Kit, or simply ORS. ORS is a bold, homegrown innovation designed to boost clinical confidence, enhance quality learning time, and strengthen competence among Rwanda's future doctors. Built around the tagline "Prepare Smart, Practice Local, and Sprint in OSCEs." What are we asking for? We are seeking 10,000 USD seed fund to create high quality content, develop a functional website and mobile app, print the first batch of sprint cards for use in medical libraries, and cover operational costs. In addition, we are seeking strategic partnerships with academic institutions, medical educators, and aligned organizations, plus expert mentorship to ensure technical accuracy, evidence-based content, and contextual relevancy. So far, we have pitched this idea to the chair of the UGHE Innovation Center and received positive feedback. And we have built a prototype website to begin testing. What problem are we solving? Despite receiving world-class training from global experts at UGHE, students still face a lack of accessible, high-yield, and locally contextualized resources for OSCE and Viva preparation. Second, there is inconsistent preparation approaches across institutions in Rwanda and the region. We want therefore to democratize access to effective clinical learning tools, not just at UGHE, but for all medical students and assessors across Rwanda, Africa, and beyond, by strengthening peer-centered learning and improving standardized clinical exam preparation, and aim to increase success rates and eliminate failure and retake rates, which is high according to a regional study by Kibuka. Therefore, here is our vision for the solution. ORS will offer modular system-based sprint kits, both online and hard copy versions, interactive sprint cards, which can be gamified for peer-led sessions, AI-enhanced learning features to keep pace with advancing medical technology. These tools will make accessing and practicing key clinical concepts for OSCEs equitable, easy, engaging, and effective wherever students are.
To ensure sustainability beyond the pilot, the OSCE Ready Sprint Kit uses a hybrid model combining funding and revenue streams. We are starting with seed funding for prototype development supported by institutional partners like TUFH, UGHE, MedSAR, and working with educational platforms like Osmosis, Calarex, and Lecturio. We also aim for government support through the Ministry of Health and Higher Education Council to help scale and institutionalize the toolkit. On the revenue side, we rely on academic grants, sprint kit sales, and subscription model for premium content. Long term, we aim to integrate the toolkit into university curricula, making it both accessible and self-sustaining. Our implementation follows a four-phase plan to ensure a scalable rollout. Month 1 to 3, we will conduct needs assessment in 3 Rwandan medical schools and develop prototype Viva and OSCE modules. Month 4 to 6, we will pilot the sprint kit with 60 students from UGHE, UR, Asome, and finalize print materials, launch the website, and begin collecting ARI feedback. Month 7 to 10, we will use student input to refine content, start official launches in Rwandan schools, and strengthen partnerships. Beyond month 10, we will scale across East Africa, seek validation from regional councils, and develop advanced clinical modules. This initiative is led by myself, Ikuzgesha Berozin, and Alex Ainebiona as project coordinators, alongside student representatives from other universities. We are supported by esteemed faculty advisors from UGHE, including Professor Daniel, Professor Abebe Bekel, Dr. Natalie McCall, and Dr. Patrick, as well as Dr. Hiba. Together, we bring student-driven innovation and academic rigor to this project. Thank you so much.
Hello everyone, my name is Clara Moreira and this is Brick by Brick, Empowering Youth to Lead in Science, initiative of SNO FPS Brazil. In Recife Tijolos community, fewer than 25% of youth finish high school. We believe every unfinished brick of education is a missed opportunity. That's why we're transforming classrooms into launchpads for long-term change, building bridges between science, health, and opportunity. To move forward, we are asking for 1,000 seed grant to fund our first year activities. Official endorsement as an FPS station project. The project is already aligned with FPS station guidelines. Partnerships with local schools and NGOs. And these three pillars, funding, institutional support, and community connection, will lay the foundation for impact.
Problem/gap. Tijolos faces three urgent challenges. First of one, education equality. Only 1 in 4 students completes high school. Health literacy void. Chronic conditions are rising while science education remains scarce. Opportunity desert. Despite scholarships from FPS to 1 physiotherapy student and 7 distance learners, most youth still lack mentorship and pathways to success. Brick by brick is our response, expanding FPS's current efforts into a full community-rooted program. Solution. Our solution is a 4-step program that aligns directly with FPS's mission to promote health and education. Spark. Weekly STEM and health workshops led by student monitors, introducing students to insights and to FPS. Build. Hands-on mini projects that turn knowledge into action. Showcase a community science fair and social media campaign to celebrate local achievement. Scale. Train a new cohort of monitors and publish a playbook through the TUFH network. We move from curiosity to careers and toward health equity.
About our financial model. Our 1,000 seed grant will be distributed as follows. 400 stipends for student monitors, 200 community events and engagement, 150 marketing and visibility, others 150 contingencies like transport, internet, etc., 100 educational kits and materials. In addition, we benefit from non-monetary FPS support like classrooms, faculty mentorship, university platforms, and local partnerships. For year 2, we'll seek funding also from CNPq and PIB extension scholarships, local sponsors like clinics and businesses, and TUFH Innovation mini grants.
And our timeline is structured across one academic year. From July to September, we will recruit monitors and run a baseline survey. To October to December, launch workshops and host our first science fair. From January to March, evaluate and refine our materials and curriculum. From April to June, train the next cohort and publish our impact report. Beyond, expand to new communities and share our playbook via TUFH. And about our justification of investment, we have the local impact, the sustainability and scalability and visibility, where we're gonna align it with FPS institutional mission and the global health values of TUFH.
Perfect. And now we have our team. Our leadership includes João Lucas, physician and TUFH member, myself, Clara Moreira, nutrition student and legal intern at FPS, and also we are supported by our faculty monitor called Jessica Siqueira, 4 selected student monitors from 2 volunteers with capacity to scale up to 10 students later, community partners, teachers and health agents from Tijolos.
And Brick by Brick is more than a project. It's a bridge to a healthier, more empowered generation.
With your support, we can help build that future, one brick at a time.
Thank you so much. We are welcome to your questions.
Hello everyone, my name is Hannah. I'm a student at the University of Cape Town and in South Africa, and I'm here to discuss the theme that I have for an SNO chapter to be established throughout Africa in the institutions called Towards Transformative Curriculum Change. So why is there this need for change? From a personal perspective, I've been political my entire life. I have a history of activism within my family, and I believe that everything is political, from your choice of food to where you get educated, to what you get educated on. Why we all need to be political is because politics represents the art of what is possible, and that possibility drives students to make change. We are in a world of ideological shifting, and this is shown through the youth rising to combat the systems they are in. And there are 2 examples of this. Greta Thunberg now going to university because it does not talk or focus enough on climate change, something that affects all of us. In South Africa in the 2015, the Fees Must Fall movement, a national protest against high university fees that affected everyone. In terms of curricula in the apartheid era in South Africa, it focused on more for westernized curriculum, not representing majority of South Africa's population. In post-apartheid South Africa, not much has changed in the curriculum. It's still very Western. Therefore, now is the time for change for curriculum and student inclusivity as a result. So what is the problem exactly? The current state at UCT is that there's a fragmentation between health sciences degree programs. As much as there are curriculum change societies, they are not integrating together in terms of cross-degree movements, and they don't have enough manpower or global perspective to create relevant change. What is the current, how does it actually work in UCT? How does curriculum form actually work? Student voices in curriculum change are in the process of being properly established as we speak, and they do not have the manpower or global perspective from other universities to establish effective and relevant change. What we are trying to do is establish SNO chapters focused on inclusive curriculum reform. This will be, instead of creating a parallel structure that basically focus on curriculum change, will be integrating into student societies, into faculty boards to create meaningful change, to provide manpower, to provide an international perspective through SNO's social media, through SNO's people on curriculum change, to create relevant, effective change. So here's a bit of the goals of what we're trying to establish. The most important ones is building bridges between students and faculties for sustainable dialogue and using SNO's international credibility to drive awareness and legitimacy. In terms of how students can be involved exactly, there are various ways. One of them is being an interviewer or being interviewed for curriculum change if you are passionate about it, and interviewing faculty members about it. And this will be posted on the SNO social, so you can get a global perspective from other people within SNO on curriculum change and how it works with them. In terms of team composition, here are the various team compositions. The campus lead will most likely be the most active. Regional rep is the lead strategist, just basically overseeing everything. And there are the other faculty allies would be rather important as well in terms of staff partnerships, etc. In terms of the financial model, university resources will be used, therefore not much funding will be needed elsewhere. This idea is more based on ideological change rather than physical change, which is driven by youth and supported by the university and its staff. It's focused on building pride in your authenticity of your identity and focuses more on collective activism. What we're basically asking for is support through voicing your thoughts and becoming an activist to transform your curriculum for the better. University support and recognition of this platform will be appreciated to continue to make relevant changes. Here's a bit of the brief overview of plans, and the timeline to follow will provide a framework that other chapters can use to establish this chapter. I have established this in UCT, and we have done a couple things in this, including an interview and a podcast and various interviews with student societies. So why me? Why am I qualified to do this? I am passionate about politics, and I would call myself a student activist within my university. To do good and be good is my quote that I use. I believe in the good of others, and I believe that students can be passionate about systemic change when given a platform and a voice to do so. There's more you can read about me in terms of my background. And what I'm going to end this on is let's co-create change. Let's create meaningful changes, all become activists to create changes in the systems we are in, and join us in supporting transformative curriculum change today. Thank you.
Hello everyone, my name is Walid Alamin and I am the national representative of SNO Sudan. I am proud to present our project titled Rebuilding Resilient Health Education System in Conflict Affected Sudan, Healing Education to Heal a Nation. The ongoing conflict in Sudan has severely disrupted the health education infrastructure, especially in rural and displaced communities. Thousands of students are disconnected from training opportunities. We believe that student-led effort can drive change by rebuilding an adaptive and inclusive health education system that can serve even in crisis. To make this happen, we are seeking academic partnership, digital platform, support and funding to 1. Develop an accessible training platform. 2. Train student volunteer. 3. Print and distribute physical booklet. 4. Deliver student-led workshop on the ground in affected area. In conflict zone across Sudan, health education is at a breaking point. Clinical training is inaccessible to thousands of students. Communities lack access to basic health information, and there are very few localized context sensitive learning resources. This leaves a major gap in building future health professional and healthy society. Our solution is a student-led initiative with three core elements. First, a digital platform for self-paced health learning using videos, quizzes, and case study. Second, peer-to-peer workshop in displaced and rural communities. And third, printed educational material for areas without internet access. All content will be co-created by students and reviewed by faculty. Our model is inclusive and low cost. It combines both digital and printed delivery. Content is student generated, supervised by academic mentor. We will collaborate with NGOs, global health bodies, and potentially the Ministry of Health. We all and we will measure success through improved access and engagement metrics and possibly social return on investment. In the first 3 months, we will train student volunteer and design the platform structure. In the next phase, we will launch a pilot with the online training and printed material. By the third quarter, we will conduct our first in-person workshop in internally displaced or rural area. By 9 months and beyond, we aim to scale to three or more regions and engage over 200 students in the initiative. Our team is led by myself as a project lead, along with a committed medical and health students from various universities across Sudan and involve all SNO Sudan local chapter, including Jazeera, Madani University, MST, and Durman University, and Al Ahfad, and else. We are supported by faculty advisors from partner institutions and are reaching out to collaborate with the local NGOs and international organizations. Our main objective is to rebuild accessible, super resilient, and student-powered health education system in conflict-affected areas, ensuring no student is left behind and no community is left uninformed. Thank you for your attention. We invite you to join us in healing education to help a healed nation.
Good morning to each and every one of you present here. So today I'll be presenting our project Mitram, which is an SNO initiative program with the collaboration of my college of GN Medical College, Belagavi. So here is our project. Mitram is confident medication management for healthier and golden years. What are we asking for here is an institutional endorsement and branding from TUFH and the SNO in collaboration with our University of GN Medical College, a pilot partnership and funding in kind of support and professional help, especially in data security specialists and regulatory affair professionals. So what is our problem statement here is that we see there's an increase in the geriatric population and medication management difficulty, but there's extremely poor patient compliance, which leads to increased medication management issues. So technically in hospitals and clinics across India, there are a lot of medication which is being prescribed, but it has not been taken at the right time and the right moment. The compliance is really poor. This increases the disease worsening and hospitalization costs and increase the healthcare cost intent. So what we have here is an AI dispenser model, which is cost effective, has a real-time monitoring, which is not available in the already, is not there in the market. So right now, the available pill dispensers, the refill system is very cumbersome and requires manual sorting into multiple small compartments. So that is what we are solving here. So this is how our Mitram works. This is the blister pack and the tablet is falling down, which will be sensed by the ultrasound sensor and gives a real-time monitoring. We have applied for patent and this we have crossed the novelty check of our patent. So the addressable market is the aging population, chronic diseases, and to improve medication adherence. Revitalization of Mitram is by using real-time monitoring, data analytics, automated medication sorting and pharmacy tie-ups, telehealth integration, biometric authentication, and medical inventory tracking. We stand apart because there is no available AI dispensers in the market, and the ones available are too expensive, and none of them have real-time tracking, or there's no AI or data analytics. So according to the market comparison, there is around 15% CAGR per year, which is set to reach 5 billion by the year 2028. So our business model here is to produce in small batches and give for testing in hospitals and clinics. There'll be a subscription plan for smart tracking, alerts, and refills to the app system, and the revenues will be earned through the healthcare providers and consumers, which will explore partnerships with government programs and social initiatives. So this is our 2-year action plan where we aim to set pharmacy tie-ups by 2026 and go for a regional launch by April, scale up the distribution by July 2026, and robust customer support by December 2026. Finally, this is an image of our prototype, our initial prototype, and I would like to introduce our team members as myself and my mentor, Sulakshana Ma'am from the Department of Community Medicine of my own very college. Thank you so much.